Hi, my name is Lucy Honan. Thanks for joining in on the Palm Sunday online. I'm from Teachers for Refugees and I want to talk about refugees, borders, and health. In this corona moment, all the cruelty and hypocrisy in our system has been exposed more sharply. This means our solidarity and our creativity needs to be even stronger. Refugees and asylum seekers have been left out of the public health response to corona, despite the Prime Minister receiving clear medical advice that people in immigration detention should be released immediately due to the corona threat. As the men detained in Preston Mantra have made clear during their protests, refugees now face the increased risk of coronavirus infection because of their detention conditions. The refugees are the definition of vulnerable people, many with underlying medical conditions such as asthma, diabetes, heart and kidney problems, and confined in places where any idea of social distancing is a joke. The shared dining rooms, bedrooms, bathrooms across detention centres in Australia and the notorious handling of detainees by security mean that COVID will spread throughout detention centres quickly. Detention centres have run out or are already running out of hand sanitizer. English classes of more than 20 are running in rooms that don't allow for physical distancing. The Mantra Hotel is even short of food because of problems sourcing supplies. This is according to Serco. Refugees and asylum seekers have also been left out of the economic crisis response. Some countries like Portugal have declared all asylum seeker or residency applications would be treated as permanent residents during the coronavirus outbreak, so that those people have access to Portugal's National Health Service, welfare benefits, bank accounts, work and rental contracts. But in Australia, for migrant workers and refugees and asylum seekers on bridging visas, there is no corona benefit at all. Some people don't have access to Medicare, some people don't have access to PBS to purchase medicine or housing so that they can stay at home. Refugees and asylum seekers on temporary visas don't get the increase to New Start or the JobKeeper payments. And this is exactly the moment that people are losing jobs and that many charities that have supported asylum seekers are closing their doors or scaling back. More than ever before, we urgently need permanency and protection for refugees, not enforced destitution. In offshore detention too, refugees are still more vulnerable. There is overwhelming evidence that the health systems in PNG and Nauru will fall apart with COVID. They are overwhelmed currently and there are already COVID cases in Papua New Guinea. Many of the refugees there have chronic diseases or are immunocompromised. They need to be evacuated immediately. While some in government are trying to use this opportunity to bolster borders and racism, the coronavirus shows that health and compassion must always and have always needed to come before racist border protection. Prejudice has become dangerously blinding to a public health response. Border Force has spent decades whipping up phantom dangers in refugees coming by boat, but they couldn't see the very real danger that was carried by passengers of cruise ships. Border Force perceived danger in travellers from Iran and China, but prejudice blinded them to the sickness in the travellers from the USA. Border Force cannot see the public health danger in keeping refugees in detention centres, onshore or offshore. They can't perceive the danger of so many people living in destitution, unable to quarantine if they need to. We need to demand urgently that the government open quarantine centres and close the detention centres. We need permanency and protection for refugees more than ever before, not enforced destitution. These are the public health responses that are appropriate right now, and we will find every creative way of showing our solidarity with refugees and asylum seekers to demand the public health and humanitarian response that we need.